there's a big stigma that chiropractors cause stroke, and that it might even be a common thing. But this research that we're about to review says it's actually extremely rare if it actually happens. Hi there, I'm Dr. Kevin Leach here with the Chiropractic Deep Dive podcast, bringing you the most important research and information on conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic care. These research reviews, interviews, and episodes are made for you, whether you're a medical doctor, patient, or concerned family member or friend. The goal of these shows is to bring awareness of the importance of taking care of our spine and the impact it has on our health and the hundreds of different health conditions it could cause without us realizing it. I'm really trying to bring value with these, so I'd appreciate commenting on the videos, hitting the like button, and sharing them with as many people as you can. You never know who might need to see it. And consider subscribing to the channel so you can see all the other episodes and videos coming out. Thank you so much. I truly appreciate your support. Now on to the show. Welcome everyone to the Chiropractic Deep Dive podcast and the Chiropractic Research Show. This is episode number 1 and the first show of the series to start off the show on chiropractic and stroke. Again, I'm Dr. Kevin Leach and I'm here once again with my good friend and colleague, Dr. Tyler Evans. How are you, sir?
Good to see you.
Awesome. This is going to be a good and important podcast. So we have in our profession, Dr. Jerry Klum is a very well-respected chiropractor in our profession. He's done a tremendous amount for our profession. He's done several presentations on chiropractic and stroke. And so what I did was I grabbed one of these presentations that he did, and he mentions 10 different research papers in there to support, evidence against chiropractors causing stroke. And again, we're not saying that it's never happened, but we do realize, because we hear it from patients, we hear it from colleagues, that there's a stigma that it's a lot more common than it most likely is, and in real, not in fact, but in most likely, it's much more rare than public knowledge kind of thinks, or public perception seems to think.
Yeah.
So we reviewed all these studies. So Dr. Tyler and I have these studies. I'm going to go through each one just to kind of pin just a real quick paragraph highlight of each one, and we'll do a discussion for each for just all of them. But then we're going to actually do each paper as well individually and break it down even more, and possibly even in the future do more studies that support what we're talking about here. But we have a lot of the main papers, and again, thanks to Dr. Klum, because he kind of compiled all this. He put them in chronological order. He related them and why one study came out. And so I'm just going to do a quick review about that, and then we're going to do a little discussion at the end.
Dr. Leach,
Yeah.
Real briefly, would you just, I mean, I can do it or you can do it, but give a quick background on stroke in relation to the United States. Like, how many strokes are there a year? How many, are death, cause death? And then how many are what we're talking about?
You want to go ahead and do that? I've got some of the statistics here, but
yeah,
if you've got a good grasp on it.
I mean, I think if I remember, it's roughly 790, 800,000 strokes a year. That includes carotid, which is the large pipe up into the brain, and then the vertebral artery, which is a smaller pipe that goes actually through your cervical spine up and feeds the brainstem, the back of the brain. The carotid actually feeds the larger part of the brain, and when there's a carotid artery stroke, usually there's something to do with language, and then when there's a vertebral artery basilar stroke, those arteries actually go up through the upper cervical spine, up into the foramen magnum, the big hole in the base of the skull, and actually feed the base of the brain and the cranial nerves, which then you'll see problems with eye, nystagmus, and problems with vision, balance, things like that. So those are things that we're looking for in our practices on a regular basis to, really try to weed out, is this something that might be occurring? But it's a very, very small amount. So when you talk about the vertebral artery strokes versus the carotid artery strokes, what is it like? It's like 5% of the total are vertebral artery strokes.
So 1 in 230 strokes, 1 in 230, so less than 99% of strokes are the vertebrobasilar artery stroke that we're referring to here. And I'm actually glad you brought that up, because just to clarify, the claim of chiropractors causing stroke is a force issue. And so obviously, when the vertebral artery is up here and the chiropractor, or even another physical therapist or osteopathic doctor doing a cervical manipulation or a chiropractic adjustment, they think that the force is causing the stroke. And so a lot of this research, some of it is epidemiological, some of it is looking at actual force and geometry and blood flow and different things.
Mm-hmm.
And so the claim is that the force that's being put into the neck is causing the stroke. And this is, the research is seeing, okay, is that true? Is that possible? Is that what's happening? Or is it, like you said, these patients are coming into the office, they're already having a cervical dissection, which leads to a stroke. And obviously an adjustment's not going to stop that. And so what this research looks at is there a causative relationship, or is there an associative relationship? So is it association or causation? And so that's what Dr. Klum did, is he broke all these studies down to see really what the evidence was showing. And the evidence supports very strongly that if it does happen, it's extremely, extremely rare. And as we go through the papers here, you'll start to understand why.
Yeah, and it's a thing where, like, I have patients that are nurses that, they came in and they were suffering from post-concussion syndrome and other migraine issues, all kinds of problems, right? And they get well under care, but initially they're very afraid because, they work in a place where there's a lot of we call it already always listening. There's this already in the air kind of talk about how if someone had a stroke, better ask them, did they see a chiropractor right before they came in? Because that's probably what caused it. And that's real. And so, there's a pervasive story about this, and it's been going on since, I think Dr. Klum said in the video, like the 70s or 80s, that's when that started. And back then we didn't have the literature to refute it. And now we do. A lot of these papers are from 2000 and on. And so Dr. Klum does a great job, and let's get to it.
Awesome. So let's just get right into it. The first paper is called is Chiropractic Manipulation and Stroke by Rothwell et al., published in the medical journal, the American Heart Association. And this was in 2001. And this paper was the research that led to the landmark Cassidy study in 2008 that we're going to talk about in a moment here. So what the Rothwell study showed was that for patients under 45, patients were 5 times more likely to have a stroke if they visited a chiropractor prior to their stroke. Now, this obviously raised a lot of ears and eyebrows saying, wow, like chiropractors are causing stroke. Now, the problem with this paper is that Rothwell didn't ask what else that patient did prior to the stroke. So what the paper showed was an association, not a causation. So what they found was evidence that, yes, patients were 5 times more likely to have a stroke if they saw a chiropractor. But that just says there's an association. It doesn't say causation. So the big question that the future research needed to attempt to answer was, is there evidence that chiropractors are causing stroke, or is it just an association? And that leads to the Cassidy study.
Dr. Leach, while you're pulling that up, a couple of things about that Rothwell study, what they didn't study, that's the real takeaway from that paper is, okay, we found this data, but they go and point directly at chiropractors and just go, and make this claim that, oh, well, chiropractors must cause stroke, when in reality, they didn't study, were these patients smoking? Were they on birth control? How many times had they been to a medical doctor? A lot of other statistics that may have affected what was actually happening, right? And so it's a story of missed data, right? And so it was unfortunate, but then it led to all this work that these other Canadian researchers did, the Cassidy et al., that they really did some great work, and we have them to thank for that. So
absolutely, yeah, absolutely. So this paper by Cassidy, risk of vertebrobasilar stroke in chiropractic care. This was in the journal Spine, again by Cassidy. Now, what Cassidy did, which is why we can thank Rothwell, is Cassidy grabbed Rothwell and the researchers, the medical doctors from that study.
Dr. Sundy.
They took the data, they took the time, they took everything from that study and asked the question also, what was the likelihood of those patients to see a medical doctor? Now, what they found was the same risk factor, meaning they were 5 times as likely. I think actually in this one, they found 3 times as likely for both. So I got to dig a little bit deeper in there why it went down to 3 compared to the 5. But either way, they found it was the same, meaning patients were more likely to have a stroke if they visited a chiropractor or a medical doctor. And we know medical doctors, like 99.99999% of them, don't do cervical manipulations.
Right.
So now we have an association. This is the big finding of the Cassidy study. We have this association of, okay, these patients are having a stroke eventually, whether they see a chiropractor or whether they see a medical doctor. Now, it would lead to suggest that if chiropractors were causing strokes, then there would be a higher incidence of strokes from the chiropractor than the medical doctor, but that's not what they found. And this was a massive study. This was 110 million person years.
Right.
Over like 10 years, like it was a massive pool of epidemiological study looking at that. And so that was a huge finding with the first Cassidy study in 2008. Any comments on that one?
Yeah, just that was on the vertebral artery.
Exactly, because the one in the future I'll mention in a second here was for vertebral and carotid. And so just to kind of review again, we talk about cervical arteries. There's cervical arteries, and then there's the carotid and the vertebral. And like Dr. Evans said before, carotid's in the front, 80% of the blood flow, and then the vertebral is 20% in the back. And again, the chiropractors are accused of causing the vertebral artery one because it's close to the atlas bone and it can be stretched and a lot of force on there. So that's what the claim is again. All right, so next study is chiropractic care and the risk of vertebral stroke by Kosloff et al., published in the Chiropractic and Manual Therapies Journal. And the purpose was to repeat the Cassidy study that was done in Canada in America to see what the claim was. And what they found was even better than the Cassidy study. That not only, so just to repeat one more time here, the Cassidy study showed no increased risk of stroke by seeing a chiropractor or a medical doctor. There was an increased risk by seeing either one of them, but no increased by the chiropractor. What the Kosloff study is showing is that there was no association between vertebrobasilar stroke and chiropractic care, regardless of the age group. And because actually the Canadian study was below 45 and there was no excess risk above the age of 45. And I know you've got some thoughts on that as far as why that could be as far as under the age of 45, but maybe we'll get into that in a little bit here. Next study is systemic review and meta-analysis of chiropractic care and cervical artery dissection. No evidence for causation. That's in the title. That's a huge, typically findings aren't put in the title. this one was put in the title.
And just defining causation and correlation, causation is 1 + 1 = 2.
Right.
Correlation is 1 and then 1 over here. And there might be a 2 somewhere around, but it's not an algebraic equation.
Right. And so this one was by Church et al., published in the journal Cureus. And the importance of this study was this was done by neurosurgeons. So this wasn't even done by chiropractors. This was done by neurosurgeons. And they found, again, no evidence for causation. The next study was, again, done by Cassidy. And I think this one was done in like 2016 or something. And this is risk of carotid stroke after chiropractic care, a population-based case crossover study. Published in the medical journal Stroke. So I don't think the other one was published in a medical journal. This one was published in a medical journal, and they did vertebral and carotid, and they found the exact same thing with the carotids as they found with the vertebral. And I think it's really important to again emphasize it's always been the claim that chiropractors are causing the stroke because of the pressure put on the vertebral artery or vertebrobasilar artery, not the carotids. Is that correct?
I would say that anyone that knows the literature and understands anatomy and physiology would not put blame on chiropractors for the carotid,
right,
being so far away. However, I'm sure over time that has happened.
Has come up.
Yeah.
Well, and the point with that I was trying to say is that and they found the exact same thing with the carotids. And so again, just like the association of chiropractors and medical doctors, if we have the same thing from the vertebrals and carotids, then it's like, well, there doesn't seem to be a causative factor or evidence for a causative factor to be claimed there.
Right.
Okay, the sixth paper, and Dr. Klum obviously talks about all this. He talks about a paper that Kosloff referenced in his paper, cervical arterial dissection and association with cervical manipulative therapy. This was by Biller, published in the American Heart Association. Now, the big finding here was that, again, the medical journal, medical association, concluding that there is no causal relationship. So again, the medical profession is saying that there's no causal relationship here. So, but they still recommend an informed consent because they say that there's no causal relationship, but they're saying they're still open to the potential that it may have, and it could be very rare. And again, it could happen, and we haven't even touched on this, with an unhealthy artery, something with, the dysplasia, the Marfan syndrome, or some sort of connective tissue type disorder. Yep. Yeah. In that case, a chiropractic adjustment could actually potentially cause something like that. But there's no evidence that's been found in a healthy individual that would cause this.
Mm-hmm. When it comes down to it, when you look at chiropractic malpractice insurance versus medical malpractice insurance, the insurance companies know who has more lawsuits filed against them, big ones, and so again, being generous and being kind, I think it's important to just put it in perspective, right? And that the risk and the informed consent paperwork, the risk that you're taking on and signing that informed consent paperwork, or as a chiropractor having that informed consent paperwork, it is not a plea of guilty. It's a, it's
exactly what informed consent is that this has been claimed, there's an association there, it's a possibility, even though it's extremely rare. That's what informed consent is.
Yeah, and malpractice insurance for, the medical field is 10 times higher than what it is for a chiropractor, and
absolutely,
that's clear in the data. So, if there really were a huge problem here, the malpractice would reflect that.
Absolutely. Cool. So we're getting into the papers now that focus more on the mechanisms of injury. So the ones that we just did were more epidemiological, meaning they're looking at populations and they're saying, what's the incidence of these things happening, association, correlation, causation things. These next papers look at, oh, they actually studied and looked at the mechanism that's been claimed for the manipulation to cause stroke. So
Right.
this paper here is internal forces sustained by the vertebral artery during spinal manipulative therapy. And this is by Herzog et al., published in the Journal of Manipulative and Physiological Therapeutics. And the study was done on cadavers to test the mechanism believed to cause strokes during manipulation, which would be the stretch force to the vertebral artery or vertebrobasilar artery during the manipulation. Now, what they found was that the artery could be stretched 139% at minimum before any damage was done to it. 139% damage. They also measured how much manipulation stretched the artery. And so it was 7.5% of its length was the maximum stretch that a manipulation would cause to an artery. 7.5% for manipulation, 139% before damage was done. So the manipulation only caused 6% of the stretching that the artery could withstand before a failure. So this is a huge study. And granted, it was on, a cadaver, which isn't a live human being, but that's what most soft tissue studies are done for. So that's kind of I don't know if it's the gold standard, but it's very common. So that's a huge study right there.
Yep, definitely. Good data.
Yeah,
Very
good data. Now, next one here is biomechanics of vertebral artery segments C1 through C6. So those are the neck bones during cervical spinal manipulation, neck manipulation by Herzog and Wust, I think is how the name is pronounced. Excuse me if I mispronounce that. This was published in the Journal of Manipulative and Physiological Therapeutics as well. This was done in response to critiques of the Herzog study to measure the forces at the attachment points of the arteries, meaning where they were anchored. So they were saying, oh, you're just measuring where it's, not where it's going through the transverse process, not where it's connected to the bones. And so they did that. And not only did they find that it didn't matter, but they actually found in that study that during cervical rotation, just cervical rotation puts more strain on the artery than the manipulation does.
Yep.
So
in an exam.
Well, so that's the next study here. So this one showed that it was just cervical range. Yeah, and I had to kind of hone in and kind of figure out what the differences were on these two studies there. But I think it's, so the next study looked at, it was just, they went into a range of motion exams, right? So I think the first one was just rotation. They just did rotation and a manipulation. They found that the manipulation wasn't as powerful or strong or as forceful. And then the next study here, so the vertebral artery strains during high-speed, low-amplitude cervical manipulation by Herzog in the Journal of Electromyography and Kinesiology. Conclusion is similar to the Wust study. Range of motion testing forces exceeded the amount of force that during a spinal manipulation. So again, the stretching forces, what they're seeing is that the manipulation is lower than just moving, just a person moving through their range of motion with their neck. So another huge finding to imply, it's not, the forces aren't enough to really cause this damage here.
Yep.
And the last one here is an interesting one. And I'd never heard of this until Dr. Klum talked about it. So there's something called Bernoulli's principle.
Yep.
And so it's like when you kink a hose, the pressure builds up and then you let it go and there's a forceful shooting out. A mechanism of causal of stroke has been said that it's the blood shooting through and damaging the inside of the arteries. And what they did was they measured this. They measured during different positions. They measured during the adjustment, after the adjustment, and they found that there was no significant change in that velocity of that to again indicate there's no change during the adjustment. So that mechanism doesn't really make sense either. And that's it for the review here. We will have all of these in the description below. for links that you can go and you can get these as well. But Dr. Evans, what do you have as far as maybe discussion on any of this?
Yeah, I think great job. You really went through all those papers well. Those are the highlights, like you nailed it. One of the things that Dr. Klum pointed out was just the amount of time that a correction might be or an adjustment might be is milliseconds. It's like 6 milliseconds or something like that versus what the amount of time would be for a patient to turn their head in range of motion. It might actually be like 6 whole seconds. And so if you talk about the differences in pressure in Bernoulli's and in just in millimeters of mercury or however they measure the tension, that it would be tremendously higher just in range of motion testing than it would be in a manipulation. And so that's, another point. I can't remember which paper that was in, but I remember him talking about that.
Yeah, I think it was the one where they did, it was the second to last one here, where they did the range of motion testing. Forces exceed the amount of force of the artery during spinal manipulation. So,
yep.
And then, so again, we mentioned it just in passing before, but it's important to understand that these are healthy individuals, right? So what they found is, and I think Dr. Klum mentioned it in his presentation, I think 80% of strokes have some sort of connective tissue disorder of some kind. He mentioned like EDS type 6, Marfan's, fibromuscular dysplasia. I think that's the one he said there was 80% have some sort of fibromuscular dysplasia that have stroke. So I think the main takeaway, and you said it in the very beginning, is these patients that are having a dissection, they seek medical care, whether it's from a chiropractor, from a medical doctor, and they go on to stroke. And it's not, and again, it's not what the chiropractors are doing, but it's what's walking through the door.
Yep. Yeah.
And again, just to say that we can't say, you can't prove a negative by saying, it's a manipulation from a chiropractor, from an osteopath, from anybody has never caused a stroke. But what the evidence is showing is that if it happens, it's extremely rare, and it's for somebody who doesn't have healthy connective tissue and maybe has a connective tissue disorder, which actually many people don't even know that they have.
Right. And I believe it was that many people have strokes all the time and they aren't diagnosed. I don't remember the statistic, like how many, do you remember him saying that?
I don't remember, but yeah, that's what he was saying, is that a lot of people have these dissections and they don't even turn into a stroke. They heal naturally.
Yep. Like it happens frequently. Yep. And most of the time they're not diagnosed and they're not recognized. And so it's just, these things are happening in nature, they're happening in life. And then to go and pin it on someone, it's like, of course, we all want to have a reason and objectively identify like what caused things to happen when they go wrong. But, pinning it on a treatment that is so low in
risk
versus another treatment that the risk is much higher of other problems that might incur, like cervical surgery of the spine or lumbar surgery of the spine, or even just taking daily NSAIDs or ibuprofen, like the side effects of these medications, or then you get into other medications, the side effects of other medications, the risk just mounts, right? And some simple things like smoking and the birth control, those two things together, those really create a big problem for those under 45. And Dr. Klum talked about how as we age, we actually build a protective factor into our bodies as things start to stiffen up and become harder. And so that could be a reason why under 45, these people are usually they're on birth control, and more often people under 45 would be smoking. And so, that's where that breaking point comes from. So
yeah, and again, for anybody watching this, this is This information is really not that readily available. And that's one of the reasons why I wanted to do this and why we're doing this is we're trying to disseminate this information to people because chiropractic can truly help thousands and thousands. I mean, it's an incredible profession, can help people, but if people have this stigma, this worry of an extremely rare event that could potentially happen to them and not get the help that they need, I mean, that's a problem. That's a huge problem. So just awareness and some in-depth knowledge really about the risk here is super important for everybody. And just getting rid of some of the stigmas that are, involved with the profession here. So
absolutely.
Yeah.
Yeah.
Cool. All right.
Great
So
job.
I'm gonna put the links. I'll just link each of the studies, and they're going to go to different places. To a lot of them are open access, so you can they're going to be free. I think some of them you got to pay for.
Yeah, but you can see the abstracts.
And you can see the abstracts. Yeah, for sure.
And if you would link Dr. Klum's video in there too, if you can.
For sure. And for those listening, Dr. Klum's speaking to chiropractic students during this presentation, so it's not necessarily to the public, so just kind of keep that in mind. Yeah, sure. Yeah. Just, I mean, there might be some terminology and some things in there, or some boring things that people don't want to, but it's an incredible presentation, and he's done a lot for the profession, and we thank him very much.
Yeah.
Cool. All right. Anything else, Doc?
Nope.
Awesome.
Great job.
Good stuff. And we'll talk to you soon. Thank you.
Okay, that's it for this episode. So what did you learn that fascinated you or surprised you about the research today? Join or start the conversation in the comments below. Hey, thanks so much for watching. To watch more of our research shows, click or tap the screen right there. To subscribe to the channel, click or tap the screen right there. Until next time, I'm Dr. Kevin Leach with the Upper Cervical Chiropractic Research Show, bringing awareness to conservative primary spine care, upper cervical chiropractic care, and traditional chiropractic. Until next time, take care and take care of your spine. It's the only one you'll ever have.